This is Mottek on Money Special Edition, Coronavirus Crisis Bear Market. I'm Frank Mottek. Mottek on Money continues, and on the medical front now, let's bring in Dr. Amar Desai, the President and Chief Executive Officer at Optum California, which includes medical groups and physician networks in Southern California. Optum is part of United Health Group, and the United Health Foundation has just committed $1 million to provide urgent assistance to LA County residents experiencing homelessness during this coronavirus crisis. The partnership with the California Community Foundation's Coronavirus LA County Response Fund, part of United Health Group's previously announced $50 million commitment to fight coronavirus. Doctor, thank you very much for coming to the line, and first give us an update on the coronavirus crisis from your vantage point.
This is really an unprecedented time for us here in California and in the country as well as around the world. Pandemic like this certainly is a once-in-a-century type of event, and because of that, all aspects of healthcare services and our society are being challenged. And certainly here at Optum, we're looking at the opportunities we have to better serve our patients and our communities, as well as our team members who are taking care of those patients.
And what is the situation in your operations there? Has it become overwhelming, or how would you describe the situation at the moment?
We're in a stable situation in the sense that we are able to provide testing services. We're able to see our patients. We're doing a lot of work with telehealth in order to be able to provide patients services by phone and through video. So all of these things are allowing us to continue to serve patients for their healthcare services needs. We're also very excited about the fact that we're able to work with some of our partner organizations across the country and specifically here in California, and really proud to announce some of the work we're doing with the California Community Foundation's LA County Response Fund.
Yes, tell us more about that. And obviously the homeless population also getting a lot of attention these days. Tell us about that.
Certainly. Well, the United Health Foundation committed $1 million to provide urgent assistance to the LA County residents experiencing homelessness as they face unprecedented hardships during the pandemic. As I said earlier, the pandemic affects all people, but the sickest and most vulnerable are oftentimes disproportionately impacted. And in the context of this, we really wanted to work with organizations really focused on issues of homelessness as well as food insecurity. And so the LA County COVID-19 Response Fund will support LA County clinics and hospitals serving the uninsured and underinsured individuals, triaging those who are sick and exposed. And the fund will really help clinics respond to increased patient flow, assist unsheltered residents who are especially vulnerable to the coronavirus, and low-income individuals, students, and families that are at imminent risk for homelessness. The other important thing that the fund does is assist housing providers and shelter operators to respond to the increased demand for emergency services, including outreach, and assist with social distancing and isolation for the county's homeless population.
What's your understanding of how the homeless are being handled from a medical standpoint out in the field these days?
Well, I think the county of Los Angeles and the healthcare providers continue to do a truly expansive response to COVID-19. And with that, the challenges are not only medical, but they're really oftentimes social also. And that's part of the reason why we think the California Community Foundation and their response fund is so critical, because issues of housing, issues of food insecurity, oftentimes issues of transportation have such a profound impact on people's health outside of the medical issue that an individual is dealing with. And I think public officials and the public health departments, along with private organizations like us, are all trying to do our part to solve it.
People at the top of their profession, such as yourself, being enlisted to talk about how the reopening of the economy might go. Doctor, any thoughts about how the reopening of the economy will go here in California?
I think we are very much working in lockstep with our partners within the county health department, within state and local governments, as well as the federal government, to think about doing this in a thoughtful and judicious way. We think that reopening really involves being highly aware of not only where we are in terms of infection and transmissibility, but also doing it in a way that's safe and doesn't rush ahead of our ability to truly do the right diagnostics and do the right things from a safety standpoint for the public overall.
Any idea when we might start to see things get back to relative normal here?
I really couldn't conjecture on that at this particular point. I do think that in our world here at Optum, we are seeing a moderation of the number of cases relative to some of the earlier forecasts, but I think it's still too early to know. And one of the things that I've certainly seen some of our other state and local government officials say that I think is true is we need to continue to accelerate our efforts and not take our foot off the gas. I think that's really important from a social distancing and behavioral standpoint to stamp this out as fast as possible.
Dr. Amar Desai, the President and Chief Executive Officer of Optum California. Doctor, thank you very much for coming to the line and look forward to staying in contact with you as we track all of this very, very closely.
Thank you very much for the opportunity.
I'm Frank Mottek, and this is Mottek on Money.